Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
Which of the following would be a significant intervention to help prevent lung cancer? 1. Encourage cigarette smokers to have yearly chest radiographs. 2. Instruct people about techniques for smoking cessation. 3. Recommend that people have their houses and apartments checked for asbestos leakage. 4. Encourage people to install central air filters in their homes. The correct answer is 2. Epidermoid cancer involving the larger bronchi is almost entirely associated with heavy cigarette smoking. The American and Canadian Cancer Societies report that smoking is responsible for more than 80% of lung cancers in men and women. The prevalence of lung cancer is related to the duration and intensity of the smoking. So nurses can best prevent lung cancer by persuading clients to stop smoking. Chest radiographs aid in detection of lung cancer. They do not prevent it. Exposure to asbestos has been implicated as a risk factor for lung cancer. But cigarette smoking is the major risk factor. There are no data to support the use of home air filters in the prevention of lung cancer. The nurse has assisted the physician at the bedside with insertion of a left subclavian triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done. Which of the following rehabilitative measures should the nurse teach the client who has undergone chest surgery to prevent shoulder ankylosis? 1. Turn from side to side. 2. Raise and lower the head. 3. Raise the arm on the affected side over the head. 4. Flex and extend the elbow on the affected side. The correct answer is 3. A client who has undergone chest surgery should be taught to raise the arm on the affected side over the head to help prevent shoulder ankylosis. This exercise helps restore normal shoulder movement, prevents stiffening of the shoulder joint, and improves muscle tone and power. Turning from side to side, raising and lowering the head, and flexing and extending the elbow on the affected side do not exercise the shoulder joint. Which of the following should be readily available at the bedside of the client with a chest tube in place? 1. A tracheostomy tray. 2. Another sterile chest tube. 3. A bottle of sterile water. 4. A spirometer. The correct answer is 3. A bottle of sterile water should be readily available and in view when a client has a chest tube, so that the tube can be immediately submersed in the water if the chest tube system becomes disconnected. The chest tube should be reconnected to the water seal system as soon as a sterile functioning system can be reestablished. There is no need for a tracheostomy tray, another chest tube, or a spirometer to be placed at the bedside for emergency use. A client with rib fractures and a pneumothorax has a chest tube inserted that is connected to a water seal chest tube drainage system. The nurse notes that the fluid in the water seal column is fluctuating with each breath that the client takes. What is the significance of this fluctuation? 1. An obstruction is present in the chest tube. 2. The client is developing subcutaneous emphysema. 3. The chest tube system is functioning properly. 4. There's a leak in the chest tube system. The correct answer is 3. Fluctuation of fluid in the water seal column with respirations indicates that the system is functioning properly. If an obstruction were present in the chest tube, fluid fluctuation would be absent. Subcutaneous emphysema occurs when air pockets can be palpated beneath the client's skin around the chest tube insertion site. A leak in the system is indicated when continuous bubbling occurs in the water seal column. Before we move on to the next question, The NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The primary reason for infusing blood at a rate of 60 milliliters per hour is to help prevent which of the following complications? 1. Emboli formation. 2. Fluid volume overload. 3. Red blood cell hemolysis. 4. Allergic reaction. The correct answer is 2. Too rapid infusion of blood or any intravenous fluid can cause fluid volume overload and related problems such as pulmonary edema. Emboli formation, red blood cell hemolysis, and allergic reaction are not related to rapid infusion. A 15-year-old has been admitted to the hospital with a diagnosis of acute lymphocytic leukemia. Which of the following signs and symptoms require the most immediate nursing intervention? 1. Fatigue and anorexia. 2. Fever and petechiae. 3. Swollen neck lymph glands and lethargy. 4. Enlarged liver and spleen. The correct answer is 2. Fever and petechiae associated with acute lymphocytic leukemia indicate a suppression of normal white blood cells and thrombocytes by the bone marrow and put the client at risk for other infections and bleeding. The nurse should initiate infection control and safety precautions to reduce these risks. Fatigue is a common symptom of leukemia due to red blood cell suppression. Although the client should be told about the need for rest and meal planning, such teaching is not the priority intervention. Swollen glands and lethargy may be uncomfortable, but they do not require immediate intervention. An enlarged liver and spleen do require safety precautions that prevent injury to the abdomen. However, these precautions are not the priority. Which of the following beverages should the nurse plan to give a child with leukemia to relieve nausea? 1. Orange juice. 2. Weak tea. 3. Plain water. 4. A carbonated beverage. The correct answer is 4. Carbonated beverages ordinarily are the best tolerated when a child feels nauseated. Many children find cola drinks especially easy to tolerate, but non-cola beverages are also recommended. Orange juice usually is not tolerated well because of its high acid content. Tea may also be too acidic, and many children do not like tea. Water does not relieve nausea. A 12-year-old with leukemia will be taking vincristine. The nurse should encourage the child to eat what kind of diet? 1. High residue. 2. Low residue. 3. Low fat. 4. High calorie. The correct answer is 1. Vincristine may cause constipation, so the client should be encouraged to eat a high residue diet. The other diets do not help with constipation that can occur while receiving vincristine. The nurse is assisting with conscious sedation for a 6-year-old undergoing a bone marrow biopsy. The nurse's most important responsibility during the procedure is to 1. Administer the topical anesthetic. 2. Keep the parents informed. 3. Monitor the client. 4. Record the procedure. The correct answer is 3. During conscious sedation, the client may lose protective reflexes, and adequate respiratory and cardiac function may be impaired. At every procedure, there must be one healthcare professional whose sole responsibility is to monitor the client. Topical agents must be given in advance of the procedure to be effective during the procedure. The nurse would not leave the child to speak with parents, while the procedure will be documented according to the facility's protocols. Proper monitoring of the client is the intervention most associated with reducing risks. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.